the streets of Burnie are quiet. The city is living through the strictest coronavirus lockdown in the country.
It's, really worrying.
55-year-old resident Tammy Milne has a rare medical condition affecting her joints that leaves her vulnerable.
But as I've got older, wear and tear on my body over the years has meant that I need additional care now.
For years, Tammy's relied on regular home care visits, but now she's one of thousands directly affected by an outbreak among health workers.
So the news I got today was that my carer's family's been put in lockdown because they've been put in a situation where they've been exposed to the virus through another workplace. So that's pretty scary.
For a few days we were very, very concerned.
Hello, how are you going? Hi Wendy, how are you going?
Tammy's carer Wendy lives with someone who worked in an aged care facility where another healthcare worker tested positive for the virus.
She tested negative, so that meant for us that we were all in the clear, and that was all that we needed to hear, really. I think we all thought that we're in a little bubble over here. Yeah, when it happened at the hospital, it happened so quickly.
People working across different agencies has meant that in this time of pandemic, the risk to the people they care for is so much greater, and that's a system-wide failure, I guess.
Health workers and their families make up more than half of Tasmania's 220 confirmed coronavirus cases.
Then we had a cluster of 49 cases in a hospital in Tasmania. Most of them went to an illegal dinner party of medical workers.
Police found no evidence for that claim, and Australia's Chief Medical Officer has now apologised.
This sort of innuendo and, in fact, completely incorrect statements has a real negative impact on the people who are out there trying to help the community.
Today, the Tasmanian government released its own report, tracing the local outbreak to 2 hospital patients who'd been passengers on the Ruby Princess. The report also found medical staff had continued to work with flu-like symptoms, and there was not proper use of protective wear.
The learnings that we take from this report today will enable us to consider our systems to ensure that we work even harder to keep people safe.
Health unions argue that a federal inquiry is needed.
There is still no information that's been provided about how the spread occurred, and so of course the fear is that there could be another outbreak.
In the meantime, the unanswered questions are only adding to community anxiety.
I was concerned about the long-term implications for our reputation. Everyone just piled on.
Business groups say there'll be long-term impacts for the city, which usually hosts about 40 cruise ships each year.
The hospitality and tourism industries are in a lot of trouble. I'd like to see a big national campaign, and we also need to get people within Tasmania travelling around the state.
I guess the exposure that it's receiving across the globe, it has had the capacity to unnerve and frighten some people.
This hair salon was one of thousands of local businesses forced to shut down 3 weeks ago when the state government enforced a strict regional lockdown.
It's been really, really difficult because we are a poorer socio-economic area anyway, and employment can be difficult, to have to say to people, look, we just have to close, we close now, and so quickly.
Kathy Tapp is trying to keep her full staff on the books, but with no cash flow, she's not sure how long she can stay afloat. She's applying for government assistance, but it's unclear whether she's eligible.
It's not only the amount of the dollar in the bank, it's the mental impact, it's the social impact.
Tomorrow, the state government will decide whether the tough restrictions across Tasmania's northwest will continue. But in a region that has endured high rates of unemployment and welfare dependence for years, people are determined to remain positive.
I think overall it's a very stoic community, and I think we will bounce back well.
We can bounce back. We've got the cleanest air in the world, and now we've got the cleanest hospital as well.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.